Let's have a listen to two of the doctors from Christmas Island talking about the treatment kids get and the impact. Let's have a look.
How would you rate the standard of paediatric care on Christmas Island?
Well, I guess there isn't any paediatric care really, so very bad.
How about you, Dr. Sangaran?
Abysmal. We would run out of some basic things such as IV fluids and speculums and antibiotics, scalpels, things which are required for some basic medical care on a daily basis.
Are you aware that some children have tried to poison themselves or ingest harmful substances?
Yes.
Are you aware that some children are banging their heads against walls?
Yeah, that's a common method of self-harm. It's quite clear that we've got a large number of children with significant mental distress and disorder in this population.
When we hear the evidence we heard this week from Dr. Peter Young, the Chief Psychiatrist in charge of the mental health services on Christmas Island, that some children have, it's common method of self-harm for kids to bang their heads on walls at Christmas Island. Some have tried to hurt themselves swallowing detergent and other substances. How troubled are you by that? Doesn't that make you want to act immediately, not wait for the end of the inquiry?
I'm very troubled by it, but equally I already am acting, Fran, along the lines I've already mentioned to you in terms of the services and support and facilities that we're putting in, and also by ensuring that we're not getting children going into these facilities and we're stopping them getting on boats in the first place, and I'm getting them out. These inquiries are raising a whole range of questions, and there's a whole bunch of testimony that is being provided. Now, that has to be tested against the broader context of what's occurring, and what I want to know is what the facts are, and when I have the full facts, then I can take further action to the action I've already taken.
And what has the department's reaction been to your report?
We sort of reacted with alarm and have asked us to withdraw these figures from our reporting.
I beg your pardon?
They've asked us to withdraw the figures from our reporting.
If in fact there was a problem and some of our staff did an inappropriate thing, I will deal with that. I cannot say that that actually happened in that way.
Well, this is extremely worrying, that if the information is being reduced, redacted, altered before it gets to Minister, then that is extremely concerning. And of course it comes back to the core point that we've been talking about for some time, and that is the Minister has a responsibility to be much more transparent about what is actually happening. Where this is smothered in secrecy, you get these kinds of processes where data is interfered with, statistics are changed, or reporting is not given. Frankly, it would be much simpler for the Minister to provide the Australian public with this information in the first instance.
I mean, this is an absolutely heartbreaking story.